Hello, Professor Manzella. Hello, classmates. My name is Ebony Edwards, and today I bring to you a Broken Minds presentation, The Diversities of Personality Disorder. Ultimately, this is just a summary of my literature review assignment. I start out by asking, what is personality disorder? Personality disorder, or PD, is a group of mental illnesses. These illnesses involve long-term patterns of unhealthy and inflexible thoughts and behaviors. These behaviors cause serious problems within relationships and workplaces. People with PD have trouble dealing with everyday stresses and problems. People with PD often have stormy relationships. Although genes and childhood are believed to contribute to the onset of PD, the official cause is still unknown. It is estimated that 40 to 50% of psychiatric inpatients have a personality disorder. I will now talk about types of personality disorders. There are 10 different personality disorders, plus a classification of personality disorder not otherwise specified, or PDNOS, which is ultimately a diagnosis given to people who experience symptoms of PD, yet those symptoms cannot be placed into one category. PDs are categorized into 3 clusters: Cluster A, Cluster B, and Cluster C. Each cluster has its own combination of defective characteristics. Each individual personality disorder has its own pattern of maladaptive thoughts and behaviors. Personality disorder clusters. According to Burton, 2012, Cluster A is characterized by odd, bizarre, eccentric behaviors and include paranoid PD, schizoid PD, and schizotypal PD. Cluster B is characterized by dramatic, erratic behaviors and include antisocial PD, borderline PD, histrionic PD, and narcissistic PD. Cluster C is characterized by anxious, fearful behaviors and include avoidant PD, dependent PD, and obsessive-compulsive PD. Now, I'll discuss some of the research that I did surrounding personality disorder. Generally speaking, there has been a lot of research conducted on PD. Unfortunately, there are a great variety of different topics surrounding this immensely diverse group of mental illnesses. Why is it unfortunate? Because although there is a lot of research being conducted, there are also so many different types of PD with so many different features that the amount of research that has been conducted is still insufficient. Personality disorder versus normative personality. Many researchers are interested in the similarities and differences between people with normal personality traits and people who suffer from PD. My first study was entitled The SAPIS, Personality Traits, and Personality Disorders. Ultimately, the study compared the SAPIS, which is a PD assessment tool, to the 5-factor model, which is a personality assessment tool. And it wanted to know if the SAPIS measures only basic personality traits, just like the 5-factor model, or if it measures more extensive PD features. And ultimately, it was determined that the SAPIS did indeed measure PD-related variants beyond general personality traits. The next area of my research focused on treating personality disorders. Researchers are also highly interested in identifying the most effective ways to treat PD. My second research article was entitled Effectiveness of Psychotherapy in Personality Disorders Not Otherwise Specified, a comparison of different treatment modalities. The authors wanted to investigate the effectiveness of different modalities of psychotherapy in patients with PD-NOS. They were able to gather data that suggests that short-term psychotherapy yields the strongest results, regardless of whether it's inpatient or outpatient treatment. My third research article also pertained to treating personality disorders. It was entitled Treatment of Personality Disorders Using a Whole-of-Service Stepped Care Approach, a Cluster Randomized Approach. The authors conducted this study to test whether implementing a stepped care model of psychotherapy instead of treatment as usual would reduce the amount of PD patients who visit hospital ERs and inpatient units. They determined that using a stepped care model of treatment resulted in a shorter number of days spent in the hospital. Also, patients were 1.3 times less likely to return to the ER compared with the treatment as usual model. The last area of my research focused on identifying various features of personality disorder. Each different type of PD has its own unique characteristics. As such, there are countless studies examining their features. Some focus on one PD, some focus on a cluster of PDs, and some focus on PD as a whole. The fourth article of my research was entitled State of Mind Shifts in Personality Disorders, Typical States and the Triggering of Interstate Shifts. This article explored whether or not it is possible to define PD using Horowitz's state of mind theory. The authors demonstrated that it is possible to identify state of mind shifts in a person with PD. In this study, the researchers analyzed 5 excerpts from different psychotherapy sessions of people with PD and identified the different shifts along with their triggers. My fifth research article focused on another characteristic of PD and was entitled Offenders with Antisocial Personality Disorder Display More Impairments in Mentalizing. The objective of this study was to see, 1, will violent offenders exhibit greater mentalizing difficulties than nonviolent offenders? And number 2, are any of the differences between the two groups attributed to the exhibition of antisocial personality disorder characteristics or sociopathy characteristics? The authors determined that violent offenders did exhibit more difficulties mentalizing than nonviolent offenders, particularly in the areas of perspective taking, hypermentalizing, non-mentalizing, and reading the mind and the eyes. Also, offenders with ASPD displayed greater difficulties than their counterparts. Conclusion. The term personality disorder is used to identify people who experience recurrent maladaptive thoughts and behaviors. These thoughts and behaviors are severe enough to interfere with the overall functioning of their life. Personality disorder is a mental illness that represents approximately half of the overall people diagnosed with a mental disorder. There is a lot of research being done to enhance clinical understanding of how to identify and treat people with PD. Although research is plentiful, there has not been enough done to cover all the many facets of PD. And as such, PD is an extremely diverse mental illness, and it is going to take a community of researchers, clinicians, and other professionals to figure out how to best help people struggling with personality disorder. Thank you very much.